Thank you very much, and good morning. Again, my name is Annick Anderson. Thank you, Catherine, and thank you, Michael. So I'm very honored to be here today, and I know some of you in the audience, and I'm so happy that we have some patients here that can join us today. Our mission is to inform and educate the public and patients on clinical research. And there's a variety of ways that we do that, and which I'll talk about a little bit later today, but primarily we wanted to share some of the key learnings that we've come across through all the research that we've done. So I'm the Director of Research Services at SysGroup, so what I oversee is a lot of the research initiatives that we conduct, including the Perceptions and Insights Survey, which I'll share some information with you on today, as well as we also run patient advisory boards, which again, it's a more qualitative approach, but where we bring patients together and we ask them their opinions on various protocols and ways that we can make participating in a clinical trial better for study volunteers. First thing I wanted to start with are what are some key learnings and key ways that we can improve patient engagement? And these are some of the key takeaways that we found from conducting all of our research. And this is a combination of Tufts research as well as SysGroup research. The first bullet is really to bring home the point that a patient's journey really begins way before they're actually participating in a clinical trial, and I think patients can probably relate to this. It begins way before they participate, when they first become aware of the trial, when they first, who do they talk to before they decide to participate? How do they make that decision? You obviously have the patient experience during the trial, but also we need to think about patient engagement also after the trial ends. It's very important to maintain that connection with the patients after they're finished participating. So the second bullet is that the journey is dynamic and unique to each individual patient. We can't come up with a one-size-fits-all strategy. When we think about patient engagement, we think about a strategy that's custom-tailored and culturally sensitive. The third item here is that patients want high touch while embracing high tech. What we mean by that is we all get very, very excited when new technology comes out. And we want to implement that new technology, but what we really need to keep in mind is that personal touch, that relationship, especially with the study staff and the healthcare professionals, is still very, very important. So while we design a patient engagement strategy, we really need to think about, what's the best balance between that personal touch and the technology itself. We need to make sure that we maintain that balance. As patients are well aware, when we go on this journey, we don't do this alone. There's a wide network that we need to be cognizant of as we design our strategies. Patients not only go through this journey on their own, but they also partner with their healthcare providers, payers such as insurance companies, as well as obviously family and friends that support them during this journey. So again, when we're thinking of patient engagement, we need to apply a broad strategy. The patient sees the clinical research enterprise as a coordinated and open system of care. What we mean by that is, the patient really wants the clinical research to be part of their overall general healthcare system. And we really need to be cognizant of that and make sure we go where the patient wants to be seen, mobile trials, things of that nature when designing a strategy. And the last is important. One bad clinical trial experience or questionable company practice reflects badly on all of us as an industry. And we really, we think that maybe, if one company does something for whatever it is that doesn't resonate well with the public, we need to make sure that we're all accountable and make a collective effort to improve those practices. So when I go through this presentation and present some of this research, it's nice to organize the data by these 4 core communities and ways to think about patient engagement. And when we say friction points here, we really mean areas for improvement. So as I go through some of the data, you'll see that we'll go through each of these core communities. So we'll start with the public, and I'll talk about a little bit about how we have somewhat of a limited connection to the scientific community. We'll talk about the prospective volunteer, somebody that's considering participating in a clinical trial. And we'll talk about some of the issues there, like limited healthcare provider facilitation and ways that we can improve that. We'll talk about the study volunteer, some of the research that we've done there, some of their experiences, and some of the burden that's placed on not only patients but sites as well, which is basically where the clinical research is conducted, the medical centers. And then we'll talk about the past participants and some of that sudden ending to their participation experience, and ways that we can improve upon that. So before I dive into some of the data, I just wanted to give an overview of the methods we use for one particular study that we conduct at SysScript every 2 years. And this is, again, as Michael mentioned, this is a very large study, and it really provides us with incredibly rich data on not only the public's perceptions on clinical research, but also insights into the experiences of study volunteers themselves. The questionnaire itself is quite intensive, but it really dives deep into general perceptions of clinical research among the public, what are some of the risks and benefits that are perceived, and also among study volunteers themselves, what are some of the enrollment drivers, what drives their decisions, what are their experience, what did they like, what didn't they like. So basically, the last time we conducted this survey was in 2013, and basically what we do is bring together a broad cross-functional work group from various organizations to really build a rich questionnaire, and we built that questionnaire off of the 2013 survey and implemented this in April and May of last year, of last year, and we used different organizations to support us in this effort, including Clariness. And we had an unprecedented sample size, actually, over 12,000 responses, which is amazing, and provided us with many rich ways to cut and slice the data. And of those 12,000, actually, we had over 3,000 responses from patient volunteers, which was wonderful. So just to give you a flavor for some of the characteristics of the group that we surveyed, we had some really good diversity, and we understand, there are some things that we want to call out. It's it was a little bit heavy on the North America side, and actually we've made some improvements there, because back in 2013 it was closer to 72 or 73%, so we made a concerted effort to try to get a more global audience to get some feedback there. And while the race and ethnicities was primarily white and non-Hispanic, given the large sample size, we were really able to get, a good representation from minority populations and some of their perceptions there as well. So what we find, and this is from our recent 2015 study, is that self-reported willingness to participate is very high, and this has been very consistent every time we conduct this survey. And the general perceptions of knowledge is also very high as well. They think, hey, I know about clinical research. I think I'm pretty well informed on clinical research. But what we find is that when you dig a little deeper behind the data, when you start asking questions like, well, how exactly does it work? Where research study is conducted, that's where it kind of breaks down, and you can see that there's a disconnect. The clinical research enterprise is a very insular community, and it's really important to raise that awareness and make that connection for patients, and we can do that through raising awareness of clinical research. And just as an example, I'll ask a trivia question here to break things up, but who can name a living scientist? Okay, so that's my point. So speaking of little connection, so this is a survey from actually 2010 from Research America, but it just shows you that 63% were not able to name a living scientist. And on the right, even though 64% claimed they were able to name a place where research is being conducted, when we actually asked them as a follow-up question, okay, where is it conducted? Most of them couldn't name a place. So again, it raises that issue that there's no connection there with the scientific community. And one other item that we asked was, who makes a greater contribution to human health? And you'll see here the clinical study volunteer is last here, when in fact they make the greatest contribution to the human health care. So what happens when you actually make that connection? and when you actually get someone familiar with the process, you'll see that the numbers change. And you'll see as I go through the presentation that clinical trial participants have great experiences. And it really makes a difference. And once you make that connection, you'll see here the willingness to participate is very high. Being comfortable speaking about clinical trials is very high. And you'll see at the bottom, most importantly, they understand now that research volunteers make a major contribution to public health. Again, the impact of familiarity. This is from our survey where we looked at data from people that have never participated in a clinical trial and those that have participated, and we asked them their general perceptions on risks and benefits. And you'll see here, in terms of the risks, the overall percentage of risks to the overall health is lower. And so again, once you make that understanding and you realize how the process works and what it's all about, your overall perceptions and overall thoughts about clinical research improve. What doesn't change actually is the benefits, and we've seen this time and time again among clinical research volunteers, not only quantitatively but qualitatively. We hear it all the time. One of the primary drivers for participating are altruistic reasons, helping others, helping family members. And this rings true among both the public as well as those that have participated. So this is a common theme that we hear throughout. So now we look at someone that's considering participation in clinical research. What are the kinds of things they think about, and what are ways that we can involve the healthcare providers in helping them make that decision? And we'll learn about how important that healthcare provider's recommendation is as well. I just want to highlight again, it may be intuitive, but the role of the healthcare provider and that relationship cannot be underestimated. They turn to them on the left-hand side. This was from a Gallup survey back in 2014. Physicians and nurses are the person they turn to and perceived as most trusted when it comes to health and medical information. And on the right-hand side are some statistics from our most recent study, where you see, again, the healthcare provider, again, is the most preferred source. And also when we ask them about, well, who do you talk to about your decision to participate? Well, the first person they want to speak with is their healthcare provider or their physician. And then not only that, but the percentage of patients that actually place a huge value on the recommendation of their physician as a top factor in terms of their decision to participate. And we had a series of questions actually in this survey as well, which I didn't include the slides here, but that reverse channel of communication where we asked them if, how many times did you actually bring it up with your doctor when you were discussing treatment options? Did you think of clinical research? And many times, very few, it was only like 17% brought up the topic. However, we probed a little further and we asked, well, if you do bring the topic up with your healthcare professional, what ultimately happened? And overwhelmingly, like a huge majority ended up joining the study. So again, it speaks to the role of the healthcare provider, and their thoughts and opinions and recommendations make a huge difference in driving participation. So in this slide, we actually asked respondents, where do you currently receive information about clinical research, if you do? And where would you prefer to receive information? And there's a gap here, and it was also evident in the 2013 survey as well. The preferred sources you'll see here are the primary care physician or the specialty care physician, obviously, or the study staff. When in fact, in reality, they receive most of their information from TV, newspapers, online social media, or maybe a pamphlet in their doctor's office. So again, let's provide them the information where they prefer to receive it if we can. And we had also a question in here about the most trustworthy sources outside of their doctors, so sources such as information, and the government online registry was actually the most trusted source. And TV, newspapers were on the lower end of being trustworthy, by the way. So this is actually from a recent Tufts study, and it's going to be published soon, I'm told. And this study was really based on the notion that healthcare providers don't want to refer patients to clinical research, and when in fact they're actually very willing. This study shows that, especially on the doctor side, that over close to 88 to 90% would be very willing to provide clinical trial information to patients, as well as be very open to discussing clinical trial opportunities with patients. And also, I think receiving special training in school or at meetings also helps build this awareness as well. And you'll see here, doctors are actually are very willing to discuss clinical trial opportunities with their patients. But what happens is, although they're very willing to refer patients, the actual volume of patients being referred is low. And we think that, healthcare providers should purely be referring patients based on the protocol eligibility criteria, when in fact it's a very personal decision that the doctor and patient makes on their own based on each individual patient. So the doctor's making some assumptions and about the patient's capability to participate. So ideally, we formulate a better engagement strategy with the healthcare practitioners and help provide them with the information that they need to make sure to kind of change those assumptions that they're making perhaps with particular patients that maybe would change their mind and would help them make a decision that they want to participate. Another item we wanted to bring up is, just the pool of volunteers. We asked them, what do you do? Let's say you found out that you didn't qualify for a study. What did you do after? And close to a quarter decided not to participate, and 42% decided not to do anything. And again, this is the pool of participants that could potentially be re-engaged into the cycle, if you will. Again, this is something that could really help with patient enrollment. So now we look at the study volunteer and the burden that potentially we're placing on them. And as we go into this, I'm sure many of you who are from industry right now can relate to this, but this is just numbers on paper here. We all know that complex and protocols are becoming more complex and demanding, and this is the burden that we're placing on patients as well as sites. And this is over a 10-year period. You'll see that the number of endpoints, the number of eligibility criteria has risen significantly, number of procedures, and total number of procedures per visit. So again, it brings home the point of the total burden that we're placing on patients. So what are things we can do to reduce that burden and make it easier for someone to participate? Not only for the patient, but also perhaps for the site. So how does this complexity manifest itself into actual study enrollment? On the left-hand side, we have a table that shows the increase in planned study duration to reach the target enrollment, that it's almost doubled. And also on the right-hand side, you'll see about half either under-enroll or fail to enroll a single patient. And again, this is based on Tufts data. So again, this presents challenges, and it manifests itself in different ways, and primarily, especially with enrollment challenges. We asked the participants who completed the trial, what did they most like and what did they least like about their experience? And you'll see under the least liked, again, it speaks to protocol-related issues. Study visits too time-consuming, study procedures too cumbersome. Location of the research center, this is actually, it might seem intuitive, and of course, this is a huge consideration. We hear it time and time again, also qualitatively in our patient advisory boards. If it's too far or not convenient, especially if someone's working, the location is a huge issue. So what can we do there? Can we potentially make some of the visits mobile, where a mobile nurse would come to someone's home and perform whatever procedures need to be done? On the left-hand side, you'll see that those altruistic reasons are, again, the top liked reasons, and helping advance the treatment of disease, helping others, huge drivers and motivations for enrolling in a study, but also staying in a particular study. I also want to underscore on the left-hand side the care and attention from study staff. That is a huge driver, and we hear it also qualitatively that the relationship that they have largely with the study coordinator and nurses is very important, and it's a huge retention driver as well. So again, being cognizant of that is very important. So despite this burden, the overall experiences are very, very positive. How well did your study meet your overall expectations? You'll see close to half said it exceeded their expectations. On the right-hand side, you'll see also they're very, very willing to participate in another clinical trial. And we also asked a question about whether they would like to, how their experience compared to the care they would have otherwise received in a standard healthcare environment. And most of them, or half of them, I think, said better. So again, it speaks to all the goodwill that's taking place here. And as I go into my next slides, it'll also speak to how much they want to spread the news and become an ambassador for clinical research potentially. So now we talk about, once somebody ends their experience, what happens? And I think, you probably heard it many times in different venues, but, many times the abrupt termination of a study is very disturbing to some patients, especially after they just spent so much time participating, and all of a sudden their participation ends, and no one comes into contact with them anymore. And also keeping in mind that they've built relationships with the study staff, and many times they'll look forward to coming in to visit and seeing the staff and talking to them. And if that takes place over the course of a year or 2 years or whatever it is, and all of a sudden it ends, they're kind of left hanging. So what can we do about that? How can we maintain that connection? One of the ways that we can maintain that connection is perhaps providing them with some information, communicating with them after their participation's done. The most important information they would like to receive after completing a study is a summary of the study results. And as an industry, I know we're working on this, returning, and that's a big program that we have at SysScript, but returning lay language summary of the results back to the patients. Because right now on the right-hand side, you see that it's currently not happening at a high level. And we're working as an industry to change that. The second most wanted information, if you will, is what study arm were they in? Did they receive the placebo or not? That's something that they want to know. And then the approval status. Did the drug actually get approved? What's going on? Patients are very, very interested in hearing this information, and I think just simply even providing them with a summary of the study results allows them to better understand the value of the contribution and the gift that they've given through their participation. So at SysScript, we're often asked, well, how do we apply all these principles, and how do we manage and organize our own patient engagement initiatives? And we basically built our initiatives around the patient journey. So on the left-hand side, the left triangle, we educate through various programs, and this is targeted at the public or people that might be thinking about participating in a clinical study. So we have our Aware for All program, which many of you are familiar with, but essentially it's an event that takes place around the country, and most recently we did a first international event in the UK as well. But it's about education, bringing together prior study volunteers, speakers from industry, and really handing out pamphlets, whatever it takes to educate on clinical research. We also, the Enable piece is really supporting our industry partners and health. So this is information and initiatives targeted at healthcare providers and pharma companies and sites, providing them with educational pamphlets that they can leave in the doctor's office, for example. We have our Perceptions and Insights survey that we like to present throughout globally to help educate our industry on ways that we can partner better with patients. We have our patient advisory boards that I spoke of earlier, where we bring together patients to review a protocol and provide their input. And then we have Connect. So we have, which many of you are familiar with, our lay language summary program. This is targeted at prior study volunteers. What are ways that we can connect with them after their participation's done? How can we spread the goodwill that they have after participating, and how can we leverage that? So that's it. Thank you very much. I really enjoyed myself, and I appreciate it.